days since Queensland had its first COVID case admitted here at the Gold Coast University Hospital. And today we make history by having the first vaccination here, which is a new weapon in the fight against COVID-19 here in Australia. I want to put a big shout out to the amazing team here who have worked tirelessly to get this vaccination unit ready for today. Of course, it's the first of 6 hubs, and it'll be the first of many sites that vaccinations will be delivered right across this state this year. We want as many people coming out and getting vaccinated as possible. Why? Because we know COVID is still real. It is still out there, and today we can report 2 new cases of COVID in Queensland, overseas acquired in hotel quarantine. That is why our first vaccinations, our priority group, are those working on the front line, those at our borders, those in our hotel quarantine, and those here at our hospitals who are actually working in the COVID wards, managing patients with COVID. I want to thank Zoe Park, who was our first person to get vaccinated here in Queensland this morning, a registered nurse here at the Gold Coast. I want to also acknowledge Inspector Owen Hortz from the Queensland Police Service, who is in charge of the quarantine accommodation down here. Kyle Zerteres. Kyle is in charge of venue health management out at Gold Coast Hotel Quarantine. And Kelly Kenway. Kelly was our vaccinator, our nurse giving the first vaccine here today. And also a shout out to Erin. Erin is the nurse unit manager who has been overseeing this implementation today. But importantly, Erin was one of the first to receive that patient back on the 28th of January. And here she is today overseeing the vaccination. She has been here end to end. And Erin was telling me that overnight she's been getting text messages from family wishing her all the best today and congratulating her on being part of this very historic day. I want to acknowledge Dr. Jeannette Young and her incredible efforts over the last 12 months here in Queensland. It was Dr. Young who said that the only way she could see us getting out of this, to move back to a normal environment here in Queensland, opening up our communities, our society, was a vaccination. She said that all along. We needed to take strong measures, hard and fast measures, quickly to try to manage this, but ultimately the only way we can come out of this is a vaccination. To all the scientists and researchers around the world, thank you for your incredible efforts in getting us to this point and creating this vaccine. And we know there's more being worked on, and I'm sure we'll see more developed over the next weeks and months and years, because COVID will be here for a long time. But it's how do we live with it? How do we make sure anyone who gets COVID doesn't get seriously ill and end up in an ICU? This is the answer. We have 5 million Queenslanders here, and if we want to keep 5 million Queenslanders safe, we need you to get vaccinated. So thank you to the incredible team who have helped make this happen today, to all our amazing frontline workers, our health workers, our police, our paramedics, who have helped look after us for the last 12 months and will continue to help look after us over the coming weeks and months as well. To all the retail staff who, of course, were there keeping the stores open, making sure that we had the items we need while we had restrictions in place, while we went into lockdown. But in all this positive news today, we must remember the risk is still here. Please, if you have any symptoms, you must stay home. You must get tested. You must wait for your results. Don't risk your life and other people's lives by going to work sick and not getting tested. Practice all those measures we've been doing for 12 months. Social distancing, hand hygiene, making sure that when you go to a venue, you are checking in register your details. If we get a case here in Queensland again, then we make sure we can trace people as quickly as possible. So we need you to record your details. We need venues to still be vigilant. We need to be vigilant. Now is not the time to be complacent, Queensland. Please make sure you are still aware of your surroundings. You are making sure that you are still practicing these good hygiene measures and importantly staying home. We have 7 active cases in Queensland. We need to stay on top of this, and I'm so thrilled that we are seeing this vaccine being rolled out across Australia today. On the 11th of March, the World Health Organization declared a global health pandemic. At that time, there was 118,000 positive cases. There is now 110 million positive cases in the globe. So let's stay vigilant, Queensland. We know we can do it. We came together, we united, we did this together, and we'll continue to do this together and keep all of us safe. Dr. Young.
Thank you very much. So this is an exciting day. So 1 down, 4 million minus 1 to go. So that's just fantastic. So the plan is to vaccinate every single adult Queenslander, 18 years and over, as quickly as we can. So the first target is the most crucial one. That's those 37,000 people who work in our hotels. And today we started with one of them, the inspector running the hotel here in the Gold Coast, who's just done a brilliant job. And our direct healthcare workers, and we started with Zoe here today, and Dr. Gerrard will later today be vaccinated because they've been key right from the start. They had the first positive cases here in Queensland and amongst the first positive cases in Australia, and managed them so beautifully. We didn't get an outbreak from those first cases, which was wonderful. So we are now at over 1,300 cases and rolling out a vaccine in a pandemic. So the aim is that the vast majority of people will be vaccinated rather than getting ill with COVID-19. And it's the start of where we'll be able to move. We will now be able to, once people start to be vaccinated, to look at the way forward. How do we then work with this virus going forward? It's a virus. We have lots of viruses. We know how to manage them. We've seen how to manage them. We've seen over 250 people treated here in this hospital in the Gold Coast very effectively. So I do remember those 6 deaths, of course I do, and I'm sure that those families will be grieving today with what happened. But because of the work that's been done, essentially by every Queenslander, we didn't end up with those deaths that we were predicting, or I was predicting at the start of the pandemic. So it's excellent. We did, as you hear, have 2 more cases overnight, both in hotel quarantine. One is a flight crew member who's come into the state from Doha, was in quarantine, so there's no risk to the community. The second was a gentleman who returned from Germany. Again, he's in hotel quarantine and he's already now moved to hospital. So we've got 7 active cases in Queensland and we're managing those. And then with the vaccine, we'll have that ability to go and manage it more broadly. Thank you.
And finally, I do want to congratulate Dr. John Gerrard, who is our Director of Infectious Diseases here at the Gold Coast University Hospital, and his amazing leadership here as well. We had hoped, and Dr. Young announced the other day, we had hoped for 100 vaccines here today. I can announce that there's 180 people booked in to get their vaccine here on the Gold Coast today. Wednesday, we will start at the PA Hospital, and Friday we'll start at the Cairns Hospital. Next week, we'll move to the RBWH and also to the Sunshine Coast University Hospital and Townsville University Hospital. So we'll have our 6 hubs operating from next week. We will ensure that the public are kept informed moving forward as to when they can get their vaccine. As we have said already, please don't turn up to your GP or a pharmacy or a hospital asking for a vaccine. We need to get this priority group of 37,000 people vaccinated first. and then we will be rolling out to other groups. But we will keep you informed as to when you can come forward, the general population, to get your vaccine. We know you're anxious. The Premier said her local bakery was asking her yesterday morning, when could they get their vaccine? We know you're eager. We will keep you informed. We do need to make sure that we have the certainty of the vaccine coming and how much before we can make announcements as to an exact start date. But we do hope by the middle of the year we are rolling out a vaccine to the general population in Queensland.
And is there 180 today? How many at the PA and how many on cans on Friday?
So I will have to find out what the booking numbers are for the PA and the cans at this stage, but their vaccines did arrive yesterday. They have been delivered to the hospital, so we are ready to go.
How many do you hope to have vaccinated by weekend?
Look, I'll find out what the booking numbers are with the relevant. Look, we're going to do it gradually. I'll check with Dr. Young, but we're doing it gradually. We want to make sure we get this right. This is a really difficult vaccine, and those who watched it this morning, it's a difficult vaccine to handle, to manage. We want to make sure our staff are comfortable with that, so it will be gradual. We'll get up to a peak, but that peak will very much be dependent also on the numbers of vaccines we get. Some of the vaccines that are arriving here will go to aged care as well. So the 11,000 we physically get here, not all of them will come to us. Some of them will go to aged care for the Commonwealth to administer as well. So the numbers will fluctuate, but I'll see if either Dr. Gerrard or...
Just before you leave.
Sorry?
Before you
question?
leave, are you booked in? Are you getting a shot this week?
I'm not getting a shot this week. I would love to get the vaccine, but you know what? The people who we put through here today, and the 37,000 are our priority. The Premier and the Chief Health Officer and I will be getting the vaccine as part of Phase 1B, but our priority are this group who are working on the front line, who are most at risk of getting COVID because they are directly in contact with people who are coming in through our borders from overseas and in fact who are nursing people who have COVID. So they're our priority, but we eagerly await our vaccine. We are very keen to get it. We don't know where yet, so maybe here on the Gold Coast, but I can't wait to get the vaccine.
Did you consider getting it anyway as a sort of show to the community of kind of...
Look, I appreciate there's a balance here. Of course, the Premier and the Chief Health Officer and I want to show leadership and show the public that we have absolute confidence in this vaccine. But it is also important that as we get these numbers in of these vaccines, we give it to our most highest priority group. I note that the Prime Minister got the vaccine yesterday. I have no criticism of the Prime Minister getting the vaccine yesterday. It is important as the Prime Minister of Australia to show that he has absolutely confidence in this vaccine, and we acknowledge that and welcome that. But this is a decision that we've made, and we think it's the right decision. And as I say, we'll be very keen to roll up our sleeves and get that vaccine as soon as we can.
Zoe, how did it
Sorry?
feel to get the vaccine?
Do you want to just move
Did
over
it feel
here,
like
sorry?
the same, similar to a flu shot? Did it hurt
It
at all?
actually didn't hurt at all. I hardly felt it. I feel like the flu shot hurt a lot more. It's a really fine needle and 0.3 mils. Yeah.
And how does it feel being the first week?
Very excited. It's a really exciting time for all healthcare workers and Queensland.
When did you find out you were getting it? What area of the hospital do you work in?
I work on the COVID-19 ward and I found out last Wednesday, that I'd be getting vaccinated today.
So you've obviously had exposure and dealt with people who've had it.
Yeah.
So it must give you a
Yeah.
encouragement.
Yeah.
The fact that you're not likely to go through that.
Yeah. So definitely feel safer going to work now. Yeah.
Can you talk us through the procedure, how it happened? Like you went in there, you rolled up your sleeve. How did it unfold this one?
So you do your consent and then go through a few questions, go in, get the vaccine, and then you get observed for 15 minutes after in the observation room with the nurses.
How do you feel after that?
Yeah, good, fine, really good. Yeah, I would encourage everyone to get it.
Will you be administering the vaccine yourself or different?
No, that will be a different board that will do that, yeah.
How closely have you worked with
Sorry, what was
How
that?
closely have you worked with some of these?
So we have COVID positive patients on the ward at the moment, so directly we go see them every day. Yeah.
So you get a real sense of the impact of
Yeah, yeah.
Did you work in the hospital almost 12 months you'd be the first person, A, there'd be a vaccine, and
Yeah.
you'd be the first person getting it?
It still feels surreal. It still doesn't feel like it's real. So, yeah, it's very exciting. Yeah, amazing for the healthcare workers. Yeah.
To the people who've kind of dismissed this and all the conspiracy theorists and stuff on the front line and seeing it close up, what can you say your experiences of seeing patients in here with the virus?
What do you mean, sir?
Like people who think, oh, it's not that big a deal. Like you must have seen it in intensive care, that it's very serious and this is your chance to kind of say.
Yeah, so it's a very serious thing. I've seen families being like torn apart from it. It's really sad what it has done to the patients affected and the families. It's really scary for healthcare workers to be going home and potentially exposing their family to that as well. So this is very exciting.
So that adds to your sense of relief then now you can go home
Absolutely,
and have that
definitely,
confidence.
yeah. Way more confident to be able to go home and be with my family. Yeah.
Zoe, did you look after Richard, the longest COVID patient while he was
No,
here?
he was here before I started. I started in April last year. Yeah.
What about Tom Hanks?
No, just before. Just before.
So, Bianca, can we ask you just,
By all means. Thank you very much, Zoe.
welcome.
Congratulations.
Thank you.
Brilliant job.
just on that numbers,
Yeah.
you don't know the exact number, do you know the target for this week?
1,000.
And that's,
So we aim to do 1,000 this week and then to rapidly ramp up to 10,000 a week.
and it's not
That's the
inclusive of
plan.
the Commonwealth doing their.
No. So the Commonwealth will do their numbers. They're doing a lot fewer because they've given the majority of those first doses to us, because the best way to protect people living in aged care is to stop the virus getting into their facilities. So the Commonwealth has given us 8 of the first 10 trays that they're distributing each week in Queensland, and they're keeping 2 to start in aged care and disability accommodation. So our aim is for 1,000 this week, but if people achieve more, as the Gold Coast is, of course I'll take that, as we all would. And today I just wanted to give people to get started each day. So the first day the target is 100. But again, if they do more than that, they're brilliant.
And what determines that? Is that just your ability to get through them, people through the door and needles into the arms?
Yes, it's getting people used to it, because this vaccine is so precious, they have not been able to practice using the actual vials, which is what you would normally do. You'd normally used to it, and this is different. It's a whole different process, and so they're having to very carefully do it, and they're extremely skilled, very good at what they do, but it is different. Even the way that the vaccine turns up and needs to be unpacked, all of those things. So I don't want any pressure on any of our hubs. That's why we've set that target of 100 the first day. But they'll ramp up quickly once they've worked out how they're doing it in their systems.
So is the reason you're doing 180 today is because it was easier than you expected, or why you were going to
Because they're
100?
really good.
Yeah.
They're really good. So they've gone and invited more people, but they know that the 100 is their target.
Thank you very much. Thank you.
Thank you.
Do you know when the aged care stuff will start? I know it's
I understand today, but it is the Commonwealth, so they're working that through, and they're doing it, of course, across the whole country. So there's 41 aged care facilities in Queensland that are currently scheduled to start getting vaccinated this week. So I'm not quite sure when it'll happen, what day, what times, but it's all on track.
And do you know how they're picking which facilities and which areas go first or anything?
I think you best ask them, but I noticed the 41 they've chosen in Queensland are are all through the state. So I think they're just trying to get a really broad spread across the country. But the most important thing we can do for our aged care residents and colleagues who work in aged care is to stop the virus getting into their facilities, and we've done that very effectively in Queensland. We've been very fortunate due to a lot of work done by the aged care facilities themselves, also by the community. So you would know, and this will continue, whenever there's an outbreak anywhere, the first thing we do here in Queensland is we close down access to aged care, disability accommodation, prisons, and here to hospitals, so that we minimise the risk, because they're the most vulnerable parts of Queensland. And that will be continuing that until, of course, all the residents have had the opportunity to be vaccinated.
When you stood up and announced the first case that arrived in Queensland, what was your expectation about where we would be about now? Getting the first vaccine with relatively little.
Can I say, I desperately hoped this would be where we'd be. I didn't think we'd reach it. So today is just absolutely fantastic. So just over a year to be vaccinating the first person is I'm lost for words, and I'm not often lost for words. It is just brilliant. It is so brilliant. Yeah. So please, all of you, as soon as your turn comes, get vaccinated. I will be the second someone offers it to me. Thank you.
Thanks, everyone.
Just a few.
Yes, absolutely, no problem.
Rob, you helped design this hospital to last the pandemic. Being here today to see the first vaccination in Queensland given, how do you feel?
I woke up this morning at 3 a.m. with goosebumps. This is probably the most exciting day of my professional career. We've been preparing for a pandemic. Well, I've been preparing pandemic, as have other infectious diseases physicians around the country for most of our careers, over 30 years. And now we're seeing what looks like the beginning of the end of this pandemic. Just over 12 months ago, we saw the first cluster of COVID-19 cases here at the Gold Coast University Hospital, when we saw 6 people from 3 families from Wuhan with the infection. And thank goodness the decision was made by the Chief Health Officer at the time to isolate these 3 families in our specially designed isolation unit in January of last year, and prevented what could have been a much greater disaster. We've now been training to deliver this vaccine since October. It's a very complex process, a combination of logistics, scheduling, and then finally administration of the vaccine. And for the past 2 weeks, we've been doing training sessions, dummy runs, but it's nothing quite like giving the real thing on the real day, and that's been just such a thrill. Now the Chief Health Officer hasn't wanted to put any pressure on us, and that's been very much appreciated. We've just been asked to give 100 a day, but the team wanted to give more, so we're going to give at least 170 today. And this week, well, I think we're going to give over 1,000, and probably next week we'll probably give over 2,000, all things going well. But that's if everything goes well. But our team really wants to get this vaccine out. If it all goes well, we have not been asked to do that. If all goes well, our team are keen to deliver as much vaccine as we possibly can. We have the vaccine, we have the team, we have the skills, we're trained. I believe we can do over 1,000 this week, and I believe we can. If all goes well, I believe we can give over 2,000 next week, and then we'll go from there. But the Chief Health Officer hasn't wanted to put any pressure on any of the hospitals because we don't yet know whether there'll be glitches, whether there'll be problems. We don't know that yet. But our team are keen.
Great. Thank you.
Thank you so much.
Okay.
Congratulations.
Thank you.
Just over here somewhere.